Thanks for stopping back to my YouTube channel. If you've been on my TikTok page recently and you saw a video that went viral, it's had over 1.2 million views at the time of this recording. It's a video of a foot that shows the toes moving around in all these different angles, and it almost looks like they're Play-Doh or they're pliable. Well, many people are asking, what's going on with this foot? Why are these toes moving like that? In this video, I'm going to answer some questions or respond to some comments that were on my TikTok video page and explain everything that's happening and why this person's foot looks this way. So let's get started with this video. Alright, if you haven't seen it yet, we've got it playing right here in the corner. And you can see the toes are moving in all these different directions, and they're not stable, or they look like they're barely even attached to the foot. So what's happening here? Why is this going on? This patient was sent to me for a second opinion for possible surgical correction, or why her toes were like this, or what could happen. She obviously had surgery done prior to me. There were multiple surgeries actually done, and this is what she was left with. So before I explain what happened, I'm going to just respond to some comments on our TikTok page about what people were asking. I'm no genius, but I think one's missing. Actually, they're all there. There are 5 toes, so one is not missing. Bones. Actually, it does not have bones. There are some bones remaining in the toes, but the majority of them were removed, and we'll talk about why. The last one is missing. No, it's not. They're all there. It looks like it's missing. My toes hurt while watching this. It's actually not painful for this patient to have this. She's not in pain to the toes. There are some areas on the bottom of her foot that helps. At this point, just cut it off. Actually, not a bad idea. Try putting them in rice. That's the solution, I guess, to everything, especially our expensive electronics when they get wet and stop working. Free fidget toy, I guess. I'm eating. Yeah, imagine when you work with things like this every day. So some of this, as we joke about this, it's very serious stuff. And, you do have to resume your normal activities. You do have to go and have lunch after you see some things like this. But it is a fun job. I love my job, and I love what I do, and I love helping people. What's wrong with people that they want to see this? It's true, but this is real life things that we see as physicians, and sometimes other people out there have conditions like this and they don't realize. And when they see videos like this, or they watch educational videos on my YouTube channel, they realize that they're not alone, and they come out and they'll go to their doctor to get help. The little toe is upside down. It kind of is, and it's not really upside down, it's just missing bones, and it's turned in a funny manner. It's actually missing a toenail as well, and that's why it looks like that. So let's get to it. Let's talk about what's going on with this person's foot. So one of the ways that we treat deformities of the toes, or what we refer to as hammer toes, is to go into the toe and remove part of the bone. So if your toe is contracted like this, which is what happens with the hammer toe, we go in surgically and we remove part of the bone to get the toe to sit straight. If it's not done correctly, or too much bone is taken out, the toes can become crooked, or what we call malaligned, or at an angle. So when this happens, sometimes the patients are upset and they'll go back to their surgeon and they'll say, I had hammer toe surgery, I'm not happy. This one toe is perfect, but the other two are kind of crooked. Can you do something else to fix it? Sometimes you can, and sometimes you can't. So one option is to go in and you fuse the toes straight. We'll put in surgical hardware. We'll sometimes use screws or pins to hold the toes straight. Well, in this particular patient, she had a relationship with her surgeon where the surgeon wasn't saying enough is enough, and they were going back and forth, and they kept removing bones from their toe. It was a lady. They kept removing bones from this lady's toes in effort or to try and stop the deformity or stop the contractures. And so what happened was too much of the bones were removed and the toes lost stability. So this wasn't one procedure, it was multiple procedures over several years. And some patients just want more surgery because they think they can be fixed. And this particular patient, she wasn't fixed. And the bones were actually removed. The majority of the bones, if not all of them, were removed from her toes. And the tendons and the ligaments do nothing at that point. Well, the ligaments won't do anything because they hold bones together, and there were no bones. And the tendons aren't there to attach to the bones to provide stability. So that's why you're seeing the toes flop around. So when some of you made comments out there like, just cut it off, that was my recommendation to this patient. She had the great toe, which was still functioning properly, but the lesser toes, and all 5 of them are there, the lesser toes weren't functioning properly. So while she wanted another revisional procedure for these toes, I wasn't able to offer her that. My recommendation was to perform what we call a transmetatarsal amputation, where we remove all of the toes and you're left with a flat foot. It's very functional, where you're left with the end of the foot being flat. You can have an insert made for your shoes that allows it to become accommodative. You can still walk. Many people wouldn't even know that you're missing your toes while you're walking. She was adamantly against that. She is up in age, so she's at the point of her life where she just wants to remain functional and not have any problems. So we can still manage her. I've been seeing her now for over 10 years. We're still able to manage the problem. She gets occasional calluses to the bottom of the foot, but she is left with non-functional toes. So I hope this answered all your questions out there. To all my YouTube followers, if you haven't seen this video, head over to my TikTok page where you can see this video that we're talking about. And if you have any comments, leave them in the comments section below. Make sure to like and subscribe to see more videos that we'll be posting in the future. Thanks.